Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And in this case, we're honored to have with us Jenny Matthews. She's the executive director of A Step Ahead Foundation of Middle Tennessee. How are you doing?
Hi, Jeremy. I'm great. Thanks for having us today. How are you?
Doing good. So you all do a tremendous amount of good, and we'll talk about that. But let's start with a little bit of history and context. Give us some background for A Step Ahead Foundation of Middle Tennessee.
Well, we've been doing our work for about 7 years. So we started serving clients in 2016. We started with a relatively small footprint of 7 counties in which we could serve residents or students. And now we have expanded to 29 counties 7 years later. So we're really excited about that growth. And in that 7 years time, we have served 2,500 clients with long-acting reversible contraceptive and healthcare services related to that.
So that right there gives a little bit of an illustration of what you do, but go ahead and dive in deeper. So when you talk about what you do, go ahead and start laying the groundwork.
Great. So our mission is to provide access to long-acting reversible contraception. We do that by providing education about these forms of contraception, as well as provide the healthcare services. The goal there is to prevent unplanned pregnancies. So really to provide tools for women to plan their futures, whatever they want their life to look like. We want to help them with that tool to plan their families when they're ready to plan their families. So we do that by removing any barrier that we think would prevent someone from choosing long-term contraception. So let me back up a little bit. Long-term contraception for us is the IUD and implant. So that's 3 to 10 year contraception. We have hormonal and non-hormonal options. So we have a wonderful, wonderful call center staffed by our lovely staff. And at any time during normal business hours, someone can call, speak to us, and really just kind of ask questions, get a little bit of education about the work we do. And then we can certainly help navigate people to the appropriate clinic should they decide that they want to pursue this form of contraception. At that visit, we partner with 12 clinics right now at this point in 4 different counties. So even if you don't live in one of those counties, we can get people through free transportation through Lyft to and from appointments. So no cost there from a transportation standpoint. And then we, at those appointments, we cover a well woman visit, an STI test, a pregnancy test, and then this contraceptive counseling where someone gets to explore these options. And should they decide that they're interested in an IUD or implant, we also cover that cost for them. And then we cover removal at any time, which is huge. So we've really just tried to remove barrier, transportation, and then cost barrier. And then we can get people in a relatively short amount of time. When you think about how scheduling healthcare and doctor's appointments goes, it can often be months at a time, and we can typically get someone in for this consult and appointment within 4 weeks at most.
You mentioned being out at community fairs, health fairs. Talk about where the women kind of first get the word and learn about you and then take that first step.
So partners are really our key to our success in getting the word out. So we call them partners in prevention. We partner with other organizations doing really great work in our community. And whether it be a job training program or a substance use recovery center or like a community college, we just try to have a presence there. Health fairs, community fairs, just sharing about the work we do. And then people who are, exploring other resources then hear about us. So often people say, is this really true? Like, it sounds too good to be true. But we're able to connect with the community that way by working with this really strong network of over 90 partners that we have in the community so that we can share about the work that we're doing while other people are engaging in other services with other partners.
Give us an idea when you talk about unplanned pregnancies, where we have been traditionally, and obviously with your efforts, kind of where we are now, because there is some good news in terms of declining rates. So talk about that.
Yes, we are really, really excited about that. When we started our work here, the unintended pregnancy rate in Tennessee was 56%. So more than 1 in 2 pregnancies was not planned. And we're all about just people being able to plan their lives. And so now we've seen, in this past 7 years, we've seen a steady decline. to where the average is 43% of unplanned pregnancy. So we're looking at over a 10% decline in helping people plan their futures. And while we can't take all the credit, we certainly are happy about the access we've been able to provide for people.
Give us a little bit of an illustration around, and I know it's going to range dramatically, but the women who are coming to you in terms of what they're dealing with, ages, kind of paint the picture, in other words, of the women you're helping.
Yeah, it really varies. Sometimes we get college students who are saying, they call us and they say, I want to make sure I finish my education before I get pregnant. We're also getting women who are calling us who've already had a few children and they want to space their babies, or they're not ready for another baby. We have some women who find themselves on hard times and they know that having a pregnancy during this time would be difficult for them. So they know that at least for the next year or so, maybe 3 years, they are not ready to have a child and they really want to focus on themselves. So we really see people from all walks of life, whether they're students, professionals, already moms, people, down on their luck and working on themselves and wanting to focus on themselves. We really see it all, and we're happy to serve anyone in any capacity. And that actually leads me to the guideline for someone to participate with us. The only guideline is geography. So there are no financial restrictions, and there are no insurance restrictions. So as long as they come to us and, cost is a barrier, we're there to fill that gap and really meet that need.
You touched on it at the onset, but talk about your focus area geographically, and then through your other partners, how far of a spread you have in Tennessee.
So we have just added these 11 new counties. So we cover 29 counties, so a good chunk of Middle Tennessee, all the way, to the Kentucky border, all the way south through the state. And then there are 5 other affiliates through A Step Ahead. So we are all separate organizations, yet we all focus on the same work and providing free contraception. And so we cover collectively 85 of the 95 counties in Tennessee. So we are really proud to have that much statewide coverage. Certainly, we hope to have those other 10 counties covered in the near future.
Nice. What's been the feedback? What are some of the testimonials that you've been receiving from the women?
Wow. That's my favorite part of the job. It really is. We survey our clients, and the majority of the time we just hear absolutely rave things from the first interaction they have with us. Everyone's so kind and helpful and helping me navigate this, to the clinic staff, and people are just so grateful. I would say gratitude is the overwhelming word that we hear, thankfulness, and then relief. We hear people say, I finally don't have to worry. I can, be more relaxed and not so worried as I'm focusing on so many other parts of my life. And so I think we're really providing that opportunity for people to not be so stressed. And then oftentimes we hear people just say, I really was able to get my feet under me by focusing on myself. So a lot of foundational work, I think, that people get to, focus on themselves when they know that they're covered as far as not experiencing pregnancy when they're not ready.
Go back and tie that into the conversation we were having earlier, that thread around unplanned pregnancies and the ripple effect that creates in the community. Because when you're able to plan, then you talk about, having more financial freedom, being able to pursue the jobs. There's economic, pieces to it. There's a lot that goes into this larger impact in the community, if you will, when people are able to take control of their lives. Talk about it in that context of the larger picture, if you will, for what you're doing and the impact it has in the community, the ripple effect.
Yeah. And we certainly recognize that, there's that individual effect. There's the family effect, what it has on a family unit when there are already existing children, when mom and parents aren't stressed, and when they're not, overloaded with their responsibilities. And then certainly we recognize that there's that community ripple effect. So we think healthier individuals, healthier families, and then healthier communities. And so people can focus on themselves, give back to the community, work, go to school, continue their education, whatever it may be. We recognize that this while we're so focused at the micro level of the individual and the client experience, that's our number one priority. We do recognize that there's a huge ripple effect throughout the community. As we have healthier people in the community, we certainly have healthier communities at large.
Absolutely. Let's go ahead and talk about now how the community can help your efforts. So you talk about opportunities to get involved and support you. Talk about those ways we can get involved and support you.
Well, I love to share about that. What I would say is if anyone works with, volunteers with, knows of any organizations who work with young women, middle-aged women who still might experience pregnancy, get us connected with them. Shoot us an email. Our website, I think, can answer a lot of questions. So visit our website. It's www.astepaheadmiddletn.org. We have information listed there. We have our partners listed. There are volunteer opportunities. So we certainly love volunteers. That ranges from someone tabling with us at a community event, someone coming in and doing, administrative work with us and getting their hands dirty that way. And then certainly just spreading the word, thinking about anyone they know that might want to know about these resources or organizations that would. And then there's certainly obviously always an opportunity for people to donate financially as well, if that's their greatest gift and talent they'd like to give.
When you talk about the financial support, give us an idea, and you don't have to be exact on this, but when you talk about how much money it takes to run the operation and do all the good you do, give us an idea of how much money you have to raise each year.
Well, our budget now is over $1 million as we have expanded. So it cost us about $350 to serve one client. I will say if someone were to go and pay for that out of pocket, it would exceed probably $1,500 for them. So we have driven down costs. We can access these costs with the federally qualified health centers we partner with at really the lowest rate possible. So we are very, very conscientious about how we spend our money, very thoughtful about it. And we certainly feel like we can really stretch our dollar. And so as we have grown, expanded our footprint, we just want to be able to provide this to more and more people. So we have great local foundations who support us, and then other funders as well. And then certainly individuals. We have longtime donors who, each year they see the need and they think, I want to help one person get access to this so that they can plan their future. And so they might make a $350 donation once a year, and they know that they make a difference that way.
Yeah. You mentioned at some point spreading across the state of Tennessee, covering all counties. So that's obviously a larger goal within the footprint. What are some of your personal goals tied to obviously Middle Tennessee for the future?
I really would like to serve people closer to where they live. So as I mentioned, we have four counties where we have clinics. Really like to expand that footprint so that people are not, taking an hour-long Lyft ride to their appointment. We recognize this is a big decision for clients, and we certainly would like to serve them closer to their home. So expanding our clinical presence in those more rural counties or counties like more outside of the Nashville area is a huge goal of ours for this year. And then we just have done some planning, and certainly we want to focus on education as well. So it's not always about that, clients actually coming in for healthcare services. It's just about education and awareness, getting people thinking about this, feeling comfortable talking about it. And so we are focused on our education and all that we can provide that way as well.
How has coming out of the pandemic impacted your efforts? I've got to believe it's opened up a lot more opportunities, but how have things kind of changed, if you will, over the last few years?
Yeah, the pandemic was certainly hard for everyone, as we know. And then being in the healthcare space, I feel like a lot of this women's health got pushed to the back burner because there were other focuses. And so we were at a bit of a, plateau, not serving more and more women, but kind of at a plateau. And then goodness, this past year was by far our most productive year, serving over 750 clients with contraceptive services is something we had never done before. And so we really saw people, I think, start to get more comfortable with going back into into the healthcare environment and for other things outside of the pandemic. And so we had a really great year from that standpoint. And then it allowed us time to kind of reflect and think, okay, we've got to be better about online education and how we reach people virtually, which I think everyone got better at. So we've tried to look at some silver linings as far as providing more opportunities for us to connect with organizations who otherwise we probably wouldn't have been able to, had virtual meetings not really been a thing.
So you mentioned it being a wealth of information. Go ahead and mention it again. Website, where do we go to learn more?
Visit www.astepaheadmiddletn.org. And you can come and learn more about the work we do, the counties we're in, and certainly all of our partners, and find a way to get plugged in with us. The more people we can have involved sharing our message, certainly the better for the community.
Absolutely. Well, Jenny, thank you for all you and your amazing team do. Thank you for coming on the show.
Thanks, Jeremy.